Okay, so good morning everyone. Today we will continue with our talk on the brain MRI anatomy. Let's make very fast review on what we have seen last week. As we agreed, there are two cerebral hemispheres. Each cerebral hemisphere is made of frontal, parietal, occipital and temporal lobes, and there is gray matter and white matter, and the gray matter is on T1 appears as hypointense, while the white matter appears as hyperintense because the white matter contains myelin, which is fat, and the T1 loves fat, while the white matter appears hyperintense on T1 and hypointense on T2 for the same reason. Okay, and we agree that this we called the insula, and it's covered by what's called opericula, which are covers from the frontal, temporal, and parietal lobes. So there is a frontal opericulum like this one, the covering of the, this is the insula, covered by frontal opericulum. Opericulum means cover. Okay, like مال شلون الجدر القبض هيك نفس الشيء. Okay, so this is a frontal opericulum, parietal opericulum, and if you go down, you'll see the temporal opericulum. So you have the ventricular system. I think we talked about it last week, which is the composed of the lateral ventricle, the biggest ventricle. Okay, thank you. Just this one also. The lateral ventricle, right and left. The lateral ventricle composed of a frontal horn, an occipital horn bilaterally, and temporal horn here and here in the temporal lobes. They all meet here at the body or the atrium of the lateral ventricle. Okay, and then the lateral ventricle opens through this small tiny foramen, which is called foramen of Monro, into this slit-like ventricle, which we call it the third ventricle. And then the third ventricle will go into this tiny dot, which is the duct called the cerebral aqueduct of Sylvius. Okay, it will empty into the what? This one, the fourth ventricle, which is bounded anteriorly by the brainstem and posteriorly by the cerebellum. And from the fourth ventricle, CSF will flow through these two foramina and central foramen of Luschka and Magendie. Okay, so this is this CSF flow. Most commonly, the Sylvian aqueduct, the cerebral aqueduct of Sylvius will be most common to be occluded, and when it's occluded, there will be hydrocephalus or dilated ventricles. It will affect usually the third and the lateral ventricle, while the fourth ventricle remains relatively normal sized. This indicates that the cerebral aqueduct is occluded or obstructed, especially in case of congenital hydrocephalus. Okay, now let's take very quick look at the bone anatomy, what we can see by MRI. MRI is a very bad modality to determine or to see the bones. Bones are much better seen using CT scan. Okay, however, what we can see is the following. T1, this is a T1 weighted image. You can see the fluid, the CSF is dark. Okay, the eye globes are dark, and so everything is white. It's a fat, because we said T1 loves fat. Okay, so you can see first that this layer of white thing, this is the subcutaneous fat, the scalp. The scalp, below the skin, you can see this white line surrounding the head. Okay, this is the scalp. Good. Then you have, I hope we can show it some, you have this hypointense, the black line, and this hypointense black line. These are the inner and outer tables of the skull vault. Inner table, outer table. Okay, inner, outer of a skull vault. So cortical bone, exactly. It's bone, dense, has no protons, so it is dark on all sequences. on T1 and on T2. In between them, you can see something that is little bit hyper intense. This is the bone marrow, like any other bone, okay? Let's try it on the T2 images. Maybe you can see the same idea. It's here even more obvious. You can see the bone marrow as white and inner table and outer table. Sorry? Yeah, outer table is the cortical bone, just, okay? So, you can see here this line, this is the suture, the coronal suture, okay? Endosteal layer is the dura, okay? It's the periosteum, we call it endosteum. Inner table is a bone, covered by periosteum.
It's not seen by MRI.
Periosteum, you don't see the periosteum by MRI, okay? The periosteum is called endosteum.
The space between them is called diploic space.
Diploic space, exactly.
Like in soft tissue, lower in T1, higher in T2.
Exactly.
It is higher.
Because contain fat.
Yes.
Okay?
Hematopoietic.
No, it's not. If it is hematopoietic, it does not contain fat. If it is fatty marrow, it contains fat. It differs. Hasab. This is a young patient. She's like 20 years old, so more hematopoietic rather than fat. With advancing age, it will change into fatty tissue, fatty marrow. Sorry. So again, we have this hypointense thing here. If you follow it, you'll see that it moves towards the midline. This is the coronal suture that separates the frontal bone here and here from the parietal bone. Okay, this is the parietal bone and the frontal bone. They are separated by the coronal suture. Okay, and I hope we have a coronal image. Ah, yes, we have. And on the coronal images, you can see, this is, by the way, it's called, this is a T2 flare. We will not talk about it. It is a T2 but with dark CSF, dark fluid attenuation inversion recovery. This is a whole new topic. We will talk about it later. Okay? Anyway, so here you can try and look for this hypointense something, which is the sagittal suture joining the two parietal bones. Okay, so we have the coronal and the sagittal. Okay. Now, after that, we will go a little bit down looking for the dural anatomy. The dura, we have three layers: the dura mater, the arachnoid mater, and the pia mater. The arachnoid and pia mater are usually invisible in a normal state. We don't see them in imaging anatomy. We are looking only for the dura mater, okay? In a normal brain. If there is abnormality, this is a whole new topic. We will not talk about it, okay? So, first you have this, the dura mater is a very strong fibrous tissue. Fibrous means just fiber. No protons, no fluid, no hydrogen, means dark. In all tissue, in all sequences, T1 and T2 and the flare and whatever, they are all dark. So we see it as a dark or black line in all sequences, all images. You can see this thin line here, also here. This is the falx cerebri that separates the two cerebral hemispheres. It is in the midline, in between, and extends along the inner surface of the skull vault, okay, forming what's called the endosteum. Okay, so this is the falx cerebri, and we can see on the sagittal images, if just a second. On the sagittal images, of course, you will not be able to see it because it's parallel to the plane. Okay, you will see this dark line here, this tiny dark line, which is the falx cerebelli. So we have the falx cerebri in the middle, and the falx cerebelli transversely separating the cerebrum from this posterior fossa in general and cerebellum in particular. Okay? So, this is, the tentorium cerebelli. I'm so sorry. Tentorium cerebelli. So we have the supratentorial compartment and the infratentorial compartment. Okay? Again, when you read any pathology book, in determining this, the area of a pathology, you'll have to determine whether it is supratentorial or infratentorial. It will be completely different differential diagnosis and approach and everything. So you have this, the tentorium cerebelli, okay, separating the intracranial compartment into supratentorial and infratentorial, and you will have the falx cerebri separating the right and left cerebral hemispheres, and you have the falx cerebelli, this tiny thing here, separating the right and left cerebellar hemispheres. Okay, so it's like multiple different compartments. Okay. Regarding the corpus callosum, we talked about it in the last session last week. For just fast notes, it is a bunch of wires of fiber, neuron dendrites and axons and things like that. They are connecting the right and left cerebral hemispheres. It is the biggest. Okay, it is exactly in the midline, composed of rostrum, genu, body, and splenium. Okay, it is a commissure connecting the right and left side. Okay. There are things called, sometimes when you read the subcortical U fibers. U, it's like the letter U, looks like the letter U. These are the axons or the wires, let's say, that are connects one gyrus to another, like here. Okay, you see them like this one. It is subcortical. This is the cortex. Okay, subcortical U fibers, like a letter U. Connects one gyrus to the next, one gyrus to the next. Some pathologies,
White matter or
they are white matter, of course. They are fibers, not neurons, dendrites and axons, and they are just white matter, myelinated nerves connecting each gyrus to the next. Okay, these are called the subcortical U fibers. There are a lot of pathologies that specifically affect the subcortical U fibers. You need to know that. Okay. Now, regarding the basal ganglia, we talk about it. It is composed mainly of the caudate nucleus, the lentiform nucleus, and the thalamus, and how they are connected, and all of these things. I think we covered it very nicely in the last week.
just one question.
Yeah.
Regarding white and gray matter. There are some terms in the book. For example, gray matter and subcortical gray matter. Is there a difference between gray matter and cortex? Like renal cortex and renal part?
Yeah, there is a difference. Cortex is the cortex of the cerebrum. Okay? Cortex is composed of gray matter. Okay? Gray matter is anywhere where there is nerve cells. Okay?
Gray matter
Like, for example, basal ganglia. Basal ganglia are composed of nerve cells, not nerve fibers. Nerve fibers, the axons, are white matter. Nerve cells body is gray matter. Okay? Gray matter is unmyelinated because there is no axons, no fibers to be myelinated. There is just the body of the nerve cell. Okay? And the surrounding gliotic tissue and astrocytes. Okay?
subcortical gray matter.
Subcortical, cortical. We have no confusion there. It's on the brain cortex. Subcortical, everything deep to the cortex. Like, for example, the insula, the basal ganglia, the thalamus, these are all subcortical gray matter and deep. You can divide them into like something similar to compartments.
There is no difference between subcortical gray matter and deep gray matter.
But anatomically speaking, there will be no difference. Okay? Anything deep to the cortex will be termed subcortical gray matter. Okay? But when you are talking specifically about the basal ganglia, you use the term deep gray matter. Okay? Now, regarding the brainstem. Brainstem is a very, very, very vital structure. Or let's say we'll talk about the posterior fossa in general, the contents of the posterior fossa. First, we agreed that the brainstem is composed of the medulla oblongata, the pons, and the midbrain. Okay, these are three components attached to each other. They contains all the wires that connects the brain to the body. They pass through there. And of course, posterior to them is the cerebellum, which is responsible for coordination of movement. Okay? So let's see what can we see of this in the axial image. First of all, we start from above, the midbrain. Okay? The midbrain, this one, connects to the cerebral hemispheres, right and left cerebral hemisphere, by the cerebral peduncle or cross. Okay? That's the same. Okay? Usually they call it cerebral peduncle. The right, you can see this right and left cerebral peduncles connecting to the cerebral hemispheres. Now, if we adjust the window just a little bit here, make it a little bit hard window, you can see these two dark dots. These called the red nucleus or red nuclei. Okay, why they are red? Because they contains iron. In real life, in anatomy, they contains iron. They appear red. Okay, iron in MRI appears black. Like hemosiderin, for example, contains. That's why they appear dark. يعني بالbrain anatomy, بالMRI of the brain, you should see them as dark dots because they contain iron. Why they are called red nuclei? Because they contain iron.
From the gross anatomy.
Yeah, exactly. From the gross anatomy, as you said. Okay? And then, let's try maybe look for further anatomical. The basal system, we covered it in the last week, and then you will start going into, as we go down, we'll join the pons. The pons, before we go, and then the medulla, okay? Before we go into the pons, each part of the brainstem connects to the cerebellum by cerebellar peduncle, exactly, okay? So we have inferior cerebellar peduncle, middle cerebellar peduncle, and superior cerebellar peduncle. The largest one is this, which is the middle cerebellar peduncle. The largest, the biggest, the most obvious one is this big one, the middle cerebellar peduncle that connects the pons to the cerebellum, okay? And if we go up, we can see this small tiny one. This is the superior cerebellar peduncle connecting the midbrain to the cerebellum. And if you go down, depending on the thickness of the cuts that we used, this is a thick cut, unfortunately. It's not so obvious, but should see somewhere here some connection through the small inferior cerebellar peduncle. Okay? These are thick cuts, so it might skip it. Okay? Now, if you look in the midline, there are some things here that connects both cerebellar hemispheres. Okay? These are three main structures. Okay? The nodule, the olive, and the what? Lingula? Nodule folliculus or olive. Okay? And you have here in the midline.
Most important is vermis.
The vermis, just you have to make sure that you see this most inferior part of the cerebellum that is surrounding the medulla oblongata and the upper spinal cord, which is called the tonsils. Okay, these might herniate and causes obstructive hydrocephalus or compression of the brainstem. Here, this tiny thing here. Okay. Sagittal view. Sorry? Yeah. on the right and on the left from the cerebellar hemisphere surrounding the, you can see this part, this is the tonsil. The most inferior part surrounding the medullary, sorry?
It's very clear in this image.
Yeah. Okay? And now, what we have here, we have the foramen magnum, which is, you can see this is the table of the bone, and this is the bone. Between them, between the clivus and the occipital bone is this. I try to show you this from here to here. This is the foramen magnum, that everything goes out and in from here. Okay, what else can we see? Let's see. From the midbrain, there is this tiny something, tiny dot. You can see this dot? This, what's called the mammillary body. This dot called the mammillary body. لا, hypothalamus will be anterior to it. Okay? This dot, there are two. I think we might see it good in coronal.
The years, about 5 years ago, it was mammillary body was a spot for final students.
Yeah, sure. It's very.
Just,
You have to know that.
This picture, what is this?
Let me, if I can show you something, I don't know, more obvious. Usually it is very well seen in the sagittal images, better than the coronal and axial. Okay, so let's again go to the sagittal to see. You can see this is the midbrain with the mammillary body. Then anterior to it is the hypothalamus, and the hypothalamus gives you this dot which rests in this curve. This is the pituitary gland resting in the sella turcica. Inferior to it is the what? The sphenoid sinus. So this is the dark thing that contains air, is the sphenoid sinus. Above it is the sella turcica and pituitary gland. Okay?
Where's the tactile plate?
Tactile plate. You need to go to the,
high resolution.
yeah, it's here a little bit.
Substantia nigra is also
It's not very well seen, but let's try to see it maybe on the, yeah, we need thin cuts, but these are unfortunately thick cuts. So, just before, let's use the few minutes that we have left. I don't want to, can we see it here? I know these are not source images, but let's try. Let's just take a quick look on the MRA and MRV. This is what we call the MRV, MR venogram. We use it to see for the cerebral venous sinuses. Okay, you look for the midline one, the big one, which is the superior sagittal sinus, and this small one that runs on the inferior edge of the falx cerebri, which is the inferior sagittal sinus. Okay, the inferior sagittal sinus will join with these deep veins. What are these deep veins? Anyone knows? Sorry? No, before vein of Galen. Hello. The internal cerebral vein and the basal vein of Rosenthal. These two veins, they will meet to form the vein of Galen. Okay, this one, this tiny, from here to here, it's the vein of Galen. And there is some congenital abnormality called the vein of Galen aneurysm. You see it or look for it here. The vein of Galen will join the inferior cerebellar, the inferior sagittal sinus, forming this, which is the straight sinus. Straight sinus runs where? At the junction between the falx cerebri and the tentorium. The tentorium and the falx at the junction between them. Okay? And the straight sinus will join with the superior sagittal sinus to form this transverse, and the transverse sinus. Let's see another view. Like here, this is the superior sagittal sinus, and it is joined by the straight sinus, which we cannot see here, forming what? This, the transverse sinus. And the transverse sinus will continue, will take a curve like that to form the sigmoid sinus. And the sigmoid sinus will continue through the jugular foramen, forming the internal jugular vein. Okay? And again, in this view, the axial view, you can see the superior sagittal sinus and the transverse sinus going into the sigmoid sinus, forming the internal jugular vein.
First the jugular bulb and then
Yeah, the jugular bulb, then through the jugular foramen, and it continues. Okay? Again, the superior sagittal sinus. Now, these are superficial veins joining the superior sagittal sinus. هذا لادي ومدري شنو, I don't know. The cortical vein of Vladi, and I don't know which the other one. Okay, I really don't care about them much. Anyway, so the superior sagittal sinus, the inferior sagittal sinus, the internal cerebral vein, and the basal vein of Rosenthal joining to form the vein of Galen, with the inferior sagittal sinus forming the straight sinus that joins the superior sagittal sinus, forming the transverse sinus, the sigmoid sinus, jugular bulb, and internal jugular vein. Okay, quick. I think there is here some, yeah, if I'm not mistaken. No. Well, let's look. This is what we call MRA, angiogram. This shows us the arteries. The previous one was veins, venogram. Now the arteries. Just very quick review of the arteries before we finish out of time. We have in the brain we have two circulations, the anterior circulation and the posterior circulation. Anterior circulation is made from the internal carotid arteries, while posterior circulation is made from the two vertebral arteries. The two vertebral arteries are branches of subclavian artery. Okay, so let's start with the anterior circulation. The anterior circulation, we have this, the internal cerebral artery, the internal carotid artery, and the internal carotid artery, right and left side, this one and this one. Okay, each one will bifurcate into what? Middle and anterior cerebral artery. This is the middle cerebral artery and the anterior cerebral artery. Okay, the anterior cerebral arteries, I think we can magnify a little bit. Let's see, zoom. Can we? Just a second. Zoom. Let's try to magnify it. So, we have the anterior cerebral artery, okay, and the middle cerebral artery bifurcating from this internal carotid artery, okay. The anterior cerebral artery joins the other side by this tiny branch here, what's called the anterior communicating artery, or sometimes we call it ACOM, okay. Now, let's come to the posterior circulation. The posterior circulation is, I think we have some nice images here. It's composed from two vertebral arteries joining each other, forming the basilar artery. Okay, let's try to fix it and magnify it. So, this is the basilar artery that will divide at the top into two posterior cerebral arteries. Okay, so you can see this is basilar artery dividing into posterior cerebral arteries. So we have anterior cerebral, middle cerebral, and posterior cerebral. Okay, before it divides, it sends this branch. Do you see it? This tiny branch here and here. Okay, so you have the basilar artery sending this branch here, and then dividing into the posterior cerebral artery. What's this branch? Superior cerebellar artery. Okay, this is the superior cerebellar artery, and the posterior cerebral artery on the left side, and on the right side we have the superior cerebellar artery, the tiny one, and the posterior cerebral artery. Between them is an important cranial nerve, that is the third cranial nerve, which is the oculomotor nerve. Okay, it passes here between them. Okay, this is the anatomical position of the oculomotor nerve. Now, the posterior cerebral artery connects with the with the middle cerebral artery by this tiny, the posterior or PCOM, posterior communicating artery. Sometimes might be present, sometimes might be absent. It's a normal variant.
In this case, left side is absent.
Yeah, exactly. In this case, the left one, I think, let's see here in this view, it will be better. You can obviously see that here it's absent, here it's present. Okay? So, this, the whole thing, called the circle of Willis. كلها هاي, the whole thing together, we call it the circle of Willis. Okay? Now, what else do we have? Sorry? Icopyca, the problem is here they took the images at the base of the basal artery before the vertebral, so it's not seen. The technicians taking the image too high. Okay? Sorry for that. Maybe we can see it later somewhere else. Okay? What else do we need to talk about? The divisions of the middle cerebral artery. The middle cerebral artery is divided into M1, M2, M3, and M4 parts. So when you see a pathology, for example, an aneurysm, you need to say there's an aneurysm in M1. Okay? And I'll try to show you something. The M1 branch is the first part, the M1 part, sorry, is the first part, the most proximal part. And then there comes the M2. The M2 will bifurcate, so this is the M1, and then the M2. The M2 will bifurcate into multiple small branches, they are the M3, and they will continue on the surface or the cortex of the brain, forming the M4. Okay? While the ACA is also divided into A1, A2, and A3. The A1 is before the ACOM, anterior communicating. Then comes the A2, and the terminal branches are the A3 branches.
Even vertebral have segments.
Yeah, sure. حتى الvertebral, but as we said, the vertebral, these are just the end of the vertebral artery, so it's not very obvious. I will not comment on that because I don't have images. Okay. You mean this?
This is Ica, yes. These are
Maybe.
Ica.
I'm not so
Ica,
sure.
Inferior, and Pica, and these are Pica arise from.
Ica and Pica, yes.
Yes.
But it's not easy to be certain of it.
This is Ica.
This should be Ica.
And this is Pica.
لا, these are branches from the posterior cerebral. This is posterior cerebral, giving these branches. This is the vertebral.
Ica.
These are two vertebrals joining the basilar.
Yes, yes.
Okay?
So these are Ica.
Most likely this is the Ica, yes.
Yes.
But Spica, I don't think
Ica
it's here.
from vertebral.
Okay? Ica is anterior inferior cerebellar artery. Pica is posterior inferior cerebellar artery, in case you don't know. Okay? So, what else? Any comments? Anything that anybody wants to know? Where is it located in the brain?
Just Dr. Jalal asked about the tectum.
Yeah, I don't have the thin cuts to show it here. But anyway, it should be.
It was clear on the picture you showed the red nucleus.
Let's try. Should be. The tectum is what's happened? The tectum is dorsal to the aqueduct of Sylvius. That's what we call the tactile plate. So, when you see the aqueduct of Sylvius, this one here, this tiny dot, everything dorsal to it, posterior to it, is the tectum, which we call the tactile plate. Okay?
The same to periaqueductal gray matter.
No, periaqueductal gray matter is periaqueductal.
Around.
Around the aqueduct. This is the aqueduct, and it's around it. Okay?
Same signal intensity as gray matter.
Gray matter, yes, exactly. Let's zoom it. Zoom. You can see here some slightly increased signal intensity. This is the periaqueductal gray matter. Okay. What else?
Just posterior to the cerebral peduncles are substantia nigra.
Substantia nigra. Nigra means black. Substantia means substance. So it means the black substance. Okay. Again, why it's black? Because it contains not iron. It contains melanin. Okay. Melanin. That's why it's black. Substantia nigra have been linked with Parkinson. When there is Parkinson, it's not black. It's a little bit lighter in color. Okay, and one of the things they do some deep brain stimulation, some therapies, I don't know what, using stimulation of these parts of the brain. It should be somewhere here. This, you can see this black thing here. These are the substantia nigra. Okay, I think now we are crossed 9 o'clock, so thank you very much.